I now have the privilege of introducing our keynote speaker, Dr. Michael Yogman. Dr. Yogman has been in pediatric practice in Cambridge for 30 years and has transitioned Yogman Pediatrics to Cambridge Pediatrics at Cambridge Hospital. Currently, he is chair of the advisory board and immediate past board chair of the Boston Children's Museum, chair of the Massachusetts American Academy of Pediatrics Child Mental Health Task Force, and immediate past chair of the National American Academy of Pediatrics Committee on Psychological Aspects of Child and Family Health, where he has authored policy statements on father's role with children, perinatal depression, the power of play, trauma, toxic stress, and resilience, and addressing early childhood behavioral problems. It is our honor to welcome you here today. Please join me in welcoming Dr. Yogman. Thank you.
Thank you so much, and I'm just thrilled and honored to be supporting Reach Out and Read. I've been a long-standing supporter of Reach Out and Read, go way back when Perry Class first started this program many years ago, and I just think that now more than ever, in the midst of the pandemic, in the midst of the tragedies in Ukraine, the focus on the whole child and reading and its ability to alleviate stress in children and families is more important than ever. So I just applaud all of your work and thank all of your sponsors. So if we can, I think Carrie's going to pull up my PowerPoint and we'll zip through, but I also welcome your questions. So next slide. No financial relationships or conflicts of interest. And the next slide will just summarize the objective. So we'll talk about adverse child experiences and their toxic stress in the absence of trusted relationships and buffering. I think people are quite familiar with this research that toxic stress and the absence of trusted relationships lead to changes in brain structure and function, epigenetic changes, microbiome changes, and childhood and adult morbidity. So that's the negative part of this. What we want to talk about is resilience, supporting relational health, safe, stable, nurturing relationships, and talking about coordinating Reach Out and Read with play and with Alan Mendelssohn's video interaction project. Is fundamental to the development of socio-emotional, cognitive, and self-regulation skills that allow kids to manage the increased stress from the pandemic. Parents can model skills, how to ask for help, how to give back to others, and how to channel strong emotions into passions and hobbies. So those are our objectives. The next slide. Needless to say, children's mental health was a crisis before the pandemic. And now, as the both Academy of Pediatrics and American Academy of Child and Adolescent Psychiatry has talked about, it's now an absolute emergency. It's the second leading cause of death. It's in adolescence. There's been a 60% increase in suicide. The higher rates of anxiety, depression, eating disorders, and even tic disorders among teens. And tragically, half with these diagnoses are untreated. We could talk a lot. There was a Brookings webinar I was on yesterday with the federal changes that President Biden is promulgating for child mental health in his State of the Union address. A lot of the issue is whether providers accept insurance and whether our workforce is adequate so that the unacceptable waiting list for people to get help. Now, magnifying the problem is that now we have over 200,000 children who've lost a caregiver due to COVID-19. And that's higher, highlighting the issues of equity and diversity higher in Black youth. The next slide. So, I mean, here are some of the challenges that the pandemic represents. I wonder if I can get, Oh, that's better for me. So social isolation, a critical risk factor. School closures, family economic hardship, family loss or illness, reduced access to healthcare. The behavioral visits in ERs increased 30% in 2021 compared with 2019. And tragically, 40% of these children boarded more than 12 hours with little or no psychiatric support. Suicide attempts visits for adolescent girls rose 51% in 2021 compared with 2019. In a national survey of youth, they described increases in emotional and physical abuse in the home during the preceding year. And needless to say, as you're all familiar, now our pediatric visits are preoccupied with mental health concerns. The next slide summarizes talk about something timely. Just April 1st, a week ago, the CDC supplement provided a survey of 7,700 children in grades 9 to 12 over the first 6 months of 2021. Over 44% reported persistent hopelessness, sadness. 37% reported symptoms of poor mental health. Over 19% considered a suicide attempt. 9% attempted suicide. Now, so that's the negative. Now, the positive is the protective factors, and that's what we want to focus on today. The power of relational health, so that what was helpful was that of the people that were doing well, over 46% reported that it was the closeness to a peer at school that was protective, and that was 28% versus 45% that had poor mental health. Let me get rid of this. So that was peer support at school, and people that were virtually connected to family, friends, and community had, again, a much lower percent of poor mental health. And you can see in the portion on the right, the importance of positive childhood experiences, feeling able to talk to your family about feelings, feeling your family stood by you during difficult times, enjoying participation in community traditions, having at least 2 non-parent adults that took a genuine interest in you, feeling safe and protected by an adult in your home, feeling a sense of belonging in high school, and feeling supported by friends. These are critical, and it really represents, and you know, as you can see, Reach Out and Read encourages those kinds of positive conversations. So the next slide really highlights this issue of moving beyond the problem of toxic stress toward the solution of relational health. It explains how the individual, family, and community capacities that support the development and maintenance of safe, stable, and nurturing relationships can not only buffer adversity, but build resilience across the life course permanently. And the next slide expands on that issue. So I think what is critical and what Reach Out and Read highlights is that medicine has been all too preoccupied with diagnosing problems and identifying deficits. And screening in the absence of interventions is a good example. People don't want to be told what's wrong with their children without solutions and strength-based models. And increasingly, we're seeing evidence that positive strengthening core life skills, supporting responsive relationships is critical. Now, this is a marvelous depiction that I love. The Alberta Family Wellness Group in Calgary, Nancy Mannix and the Talix Foundation have created this resilience metaphor. And you can see on the right are positive supports, and on the left are the toxic stress and negative experiences. And what happens is if there are more positive supports, you create more resilience. And you can create more positive supports with these responsive relationships. Again, reach out, read, encouraging that kind of communication between parents and children is a critical factor in building resilience across the lifespan. Obviously, we want to reduce sources of stress. That can sometimes be quite challenging given the politics of that. But we can also talk about strengthening core life skills, particularly executive function skills, problem solving, collaboration, creativity, all of which are the skills along with literacy that CEOs are looking for in the workforce going forward. It's not just being smart, but being able to collaborate, being able to come up with innovative solutions, being able to be creative. That's what this is all about. And so if we move to the next slide. So relational health refers to the ability to develop and sustain the safe, stable, and nurturing relationships, which provide kids with these positive childhood experiences. Let me just see if there's something missing. Next slide. Yeah, there it is. Okay, keep going. So we talk about, and you can see shared reading is part of this. We can talk about relational health both between parent and child, or caregiver and child in childcare settings, the intrafamilial interactions, and the community level interactions, the way the community can really support kids. And I think there's some other parts of this slide. And so we can talk about it at the provider level, at the practice level, when we have a medical home with integrated behavioral health, and when we can move from tolerable stress or positive stress to buffering that toxic stress. And I think the next slide will move on. So the three lenses that we'll talk about are, one is the two-generational approach, working with parents and children, realizing that children are not static, that as with the level of books that we provide at different ages, we need to acknowledge the developmental changes over time. And finally, I think we'll talk a bit about a public health approach that encompasses both vertical changes, primary and secondary and tertiary interventions, as well as a horizontal approach that engages community resources. So let's go to the next slide. So here we have this schematic of this public health approach, that when we talk about primary prevention, we talk about universal preventions for all kids in parenting. And that's where Reach Out and Read, the Video Interaction Project, and the paper we wrote about providing parents with a prescription for play at all well visits to encourage their interactions and getting parents off their iPhones and their social media, supporting positive parenting, support groups, and other ways to mitigate social isolation that parents, and all of those things promote safe, stable, nurturing relationships and build these two-generational relational skills. Secondary interventions are where we deal with social determinants of health, screening, and provide targeted interventions for children at risk. And then finally, we'll talk more about the children who really are suffering with specific symptoms and diagnoses, whether they be anxiety, post-traumatic stress syndrome, or with specific programs, the parent-child interaction therapy, the trauma-focused CBT that repair strained or compromised relationships. So, and the next slide shows more detail. We can go through the next few slides, which will add to this. So again, when we talk about universal preventions that actively promote relational health, we want to be sure that even when kids are acting out, we love the child, even if not their temper tantrums. We understand child development. We promote positive but authoritative, not authoritarian parenting styles. And we encourage large amounts of developmentally appropriate play with Reach Out and Read in the Video Interaction Project. We proactively build these foundational skills for resilience through safe, stable, nurturing relationships that model social capacities, emotional regulation, language skills, and adaptive functioning. I think this issue about emotional regulation we'll talk about in more detail, how we move from co-regulation early on to self-regulation, which is so critical in older ages. We nurture these foundational skills as they emerge developmentally, and we want to identify the positive things, the child's passions and healthy distractions, sports, music, art, hobbies, and volunteering. And we want parents to take care of themselves, because as the model in airplanes, when airplanes lose cabin pressure, parents are instructed to put on their oxygen masks first. So if parents don't take care of themselves, they're not going to be able to provide the optimal care for their children. And again, providing opportunities to practice and implement these foundational skills. And when adversity occurs, to buffer it, to meet the child's most basic needs, make sure they're fed, they're housed, they're provided. I guess the best way to say this is reassurance that parents will be there to protect them and to provide that kind of security and predictable routines to decrease stress. Obviously, the challenges of the poor refugee children in Ukraine emphasize the importance of these parents somehow getting the message across to their children that they're going to try to protect them as best they can. The next slide. And again, we can fill in this slide. Again, is this level 2, which, there we go, where, once we've identified particular stresses, whether parental ACEs, parental mental illness, exposure to violence or poverty or racism, that we screen for these barriers and we begin to specifically mitigate these barriers with team-based care, hopefully integrated behavioral health, work toward consensus, and work on kind of simple interventions that, again, engaging often community resources. And the most difficult problem is once kids, in the next slide, really have diagnoses or more extreme symptoms. The next slide. We need to do both the level 1 preventions, the level 2 interventions, but now is when we need more treatments to mitigate these diagnoses. So again, the Therapeutic Alliance to demystify, to provide hope, and to look to evidence-based therapies, parent-child interaction therapy, trauma-based CBT, and if they're not available in your community, to advocate for the development of these therapies. Clearly, they are not widely available, but we need to work towards increasing that kind of availability. So this, I think, is, again, data that really emphasizes the power of relational health. Christy Bethel has done a lot of marvelous research using some national survey data here on 51,000 children, using an index of outcomes she calls flourishing, in which a child who shows interest and curiosity in learning new things, who works to finish tasks that he or she starts, and stays calm and in control when faced with a challenge. A lot of these can be lumped under executive function skills, but I think it's a nice measure of a child flourishing index. And the second thing she looked at, the next slide, shows the Family resilience and connection index, again, a measure of relational health. When your family faces a problem, how often are you likely to talk together about what to do? And reading certainly encourages that. Working together to solve our problems. Know we have strengths to draw on. Stay hopeful even in difficult times. And they asked parents for this measure, how able were they to share ideas or talk about things that really matter? How available were they to handle the day-to-day demands of raising children? This kind of family connection. And the next slide shows the data in this national survey. And I think it really speaks to this issue about strengths, not deficits. So if we focus on children with high ACEs, which we in previous times thought were determinant of negative outcomes, it turns out that even though kids had high ACEs, if they had high family connection and resilience, 30% of those children were flourishing. In contrast, kids with low ACEs that we thought were fine, but with low family connection, were not doing nearly as well. So it speaks to the power of family connection and resilience to enhance positive outcomes in children. And that's really the take-home message of my remarks today. So when we talk about development, we talk about this notion from co-regulation to self-regulation. So affect regulation is a moving target. Early on, I could show you a video of attuned parents and caregivers. These serve and return interactions where the baby coos, the mother coos, the baby laughs, the father tickles the baby or picks up the baby, and they're basically sharing joy. That's what can happen at 3 and 4 months when we're doing the right thing for parents and caregivers. That kind of affect regulation, calm, nurturing, caregiving. And we know that some wonderful longitudinal data from Ruth Feldman in Israel, that when parents are able to do this early on, she did a longitudinal study with preemies, followed them through adolescence and young adulthood, and showed differences in functional MRI at adolescence in the empathy center in the brain. So that talk about long-standing impact on neurobiology, there it is. If we finish this slide, we'll see, next slide. Beginning in infancy and the toddler years, again, the dyadic dance is the focus of affect regulation. And this is that Ruth Feldman data I was talking about. If the parent or caregiver is well-regulated and engaged, the child will attune to them and calm. And again, developmentally appropriate play and reach out and read can support this. And the next slide. Beginning in preschool, the child becomes moving more towards self-regulation, begins to develop as the child learns adaptive ways to cope with strong emotions, and again, formalize social emotional learning to model, teach, practice, and celebrate these skills. And again, if we talk about the power of play in childcare settings, what we want to avoid is a childcare teacher crying because her director told her to get rid of the blocks. No, we want to encourage the blocks. We want to encourage play. We want to encourage the social emotional skills in young children and not just move down the pressure of academic learning to age 3, which just enhances the stress. And next slide, I think we're just about wrapping up. Again, strong emotions demand distractions. What we want to do, if we finish this slide, the next one, we emphasize healthy distractions. There we go. Keep moving to not just people spending time on social media and iPhones, but building resilience with play, with art, with reading, with sports, with music, with encouraging kids to develop these healthy hobbies. And now to finish up, next slide, shared reading. You can see the emphasis here to channel their emotional energy into something constructive. The next slide, promoting resilience, the whole child, Play becomes the window to nonverbal behavior and joyful discovery. Reach out and read. Identification and management of perinatal depression for men and women, so that we don't let postpartum depression kind of impair those early serve and return interactions. We want to talk about father's role in social determinants of health, which has been, I think, under recognized and managed. Major role in alleviating poverty, in providing safe housing and job training, and improving our outreach to non-residential fathers. And again, all of this to develop self-regulation and executive function skills. And I think the next two slides summarize, well, this is just about play, is brain building and enhances brain structure and function. Playful learning is a fundamental part of healthy development, is crucial for 21st century skills, such as executive function, collaboration, innovation. And again, play can build resilience and build the safe and nurturing relationships with all caregivers. The next slide, we'll zip through. So these two factors, the presence of one stable and committed relationship with parents, caregivers, and other adults, can provide personalized responsive scaffolding and protection by listening to children, participating in their activities through play and reach out and read, and by encouraging the sense of personal efficacy, mastery, and the sense of agency through active participation and control. And second of all, the next slide, the skill building, both by adult caregivers and children, to enhance their capacity to plan, monitor, and regulate behavior and adapt to change. Together with the child's intrinsic resistance to adversity, a strong relationship with safe, stable, nurturing caregiving and proactive skill building will best promote individual resilience. The optimal combination may vary with the child's intrinsic predisposition and the specific stressful situation, but the ingredients are consistent. Younger ages, we can do it more simply, and I think as we're developing some more biological measures, biomarkers of individual variability with resilience, we'll be better able to target resources to the children that need it most. And lastly, I think my slide just emphasizes the fact that this goes right on through schools. And the best study I love to quote is the study by Anthony Brick of Chicago Schools and Academic Success. And the best predictor of academic success in schools is what he called relational trust between parents, children, administrators, and teachers. So thank you for listening, and thank you for all the work you do every day. I will be delighted to answer questions.
Yeah, feel free to put some questions in the chat or the Q&A section of the Zoom webinar. We don't have any questions right now coming in, but I'll give people some time. We do have a Q&A. Varsha says, thank you for such an informational presentation, Dr. Yogman. I'd love to hear about proactive skill building.
So, literacy, which is critical through Reach Out and Read, but I think what we want to emphasize is the broader impact of Reach Out and Read towards supporting that relationship with children and parents, so that reading is a chance for children and parents to expound on different things that they see in pictures and words. And that's the skill building, that's the relationship building that enhances the communication. And that's really what it's all about over the long term, that parents can ask questions as they read certain passages. They can encourage kids problem solving, they can encourage creative solutions, and they can encourage kids' sense of agency about doing all these things. And that's what reading enables. It's the same thing that play enables. It's the same thing that Alan's video interaction project enables. I think all of these things are focusing on the whole child and on the relationship that kids have that opens them up to collaborating, to communicating, and to problem solving.
Thank you so much. Got another question here. The study that you presented, and I think I'm going to go back to that slide, only showed a 3.5% improvement for children with high ACE scores and positive family connections, the 26.5% versus 30%. They comment that that does not seem very significant and asked if you had any thoughts or comments on that.
Well, I think what you're looking at is what's amazing is that number one, there's a lot of other data. If you look at the slide from the MMWR April 1st National Survey, the decrease in mental health problems, that kids that felt connected both to peers in high school and to family members, again, reinforces this notion. You know, there's no silver bullet here. You know, I think it's amazing that the kids who had high ACEs that we think were going to be, you know, changing the biology of their brains, changing their immune systems, changing their microbiome, that these things were going to be absolutely determinative of adverse outcomes. It turns out that that wasn't the case, that if they had good family connections and resilience, they actually did better than kids with lower ACEs, but poor family connections. So I don't think, you know, even if these things were even, I think it would be a positive result. So it doesn't bother me that there was only a 4% difference. You're talking about, you know, just the way family connection and resilience were somewhat protective against kids that we used to think were locked into adverse outcomes. So, and, you know, I think that that speaks to what more we can do to promote family connection and resilience to even enhance that that percentage of children who can recover from high ACEs and buffer stress. And this doesn't speak as much to just the value of family connection and resilience to kids. That the missing piece of data that I don't have on this slide, number 3, would be the kids with high family connection and resilience and low ACEs, because those kids were probably really doing well.
Thank you for the question and the answer. And I think we have
That's
time
a really
for
good question.
I think we have time for one more. I'll sneak in here. And it's about your last slide here, expanding on what you said about the preschool expulsion of Black males and the implicit bias. And also that now that we know that the pipeline to incarceration begins in 4th grade, and thinking about how this fact right here in preschool could be important and influential in that pipeline.
So, yeah, I'm glad you asked about that. In the interest of time, I didn't focus on it, but 2 comments. One is the prison to pipeline starts in preschool, and this is a really shocking and embarrassing issue in our social policy. We published a paper with some case studies of examples and have a policy statement now before the American Academy of Board of Directors, after it's gone through 3 years of reviews, that talks about how unconscionable it is about expulsion of kids from preschool. And there's some structural racism involved with Black males, but the need for child mental health consultation to preschool people, for training preschool teachers. We have 3 pages of recommendations for solutions, both by pediatricians, by community organizations, and by social policy advocates. In 2015, Head Start regulations prohibited the expulsion of children from preschool, and yet it continues. So this is a huge problem for us, and I think we really need to address it. And I can't wait. Hopefully, this policy statement from the Academy of Pediatrics will capture our national attention to a problem. I know the Obama administration did a lot of work on this with the Administration of Children, Youth, and Families, but we still have a long way to go.
Thank you so much for that question and for your answer, Dr. Yogman. I think that's all we have time for. I'm going to pass it to Emily to close us out and start us new.
Thank you. Thank you, Carrie. Thank you, Dr. Yogman. What an incredible, informative presentation. I know I've been furiously jotting down some notes here, and we're recording this to share as well. Thank you so much for spending your morning with us today.